Hello friends, welcome back to my channel. Today we'll talk about arteriosclerosis. Okay, so at first let's know what do we mean by arteriosclerosis. So arteriosclerosis is nothing but we will get over here the hardening of arteries with loss of elasticity. Okay, so you can write it over here, the hardening of arteries with loss of elasticity. Loss of elasticity. Now see, as far as the arteriosclerosis is concerned, we can classify the arteriosclerosis in the various types. But I'll mention over here the basic, there are three types. Now, if we divide the arteriosclerosis or rosis, basically you can divide it into three. First, I'll give you the very, brief idea, or you can say the introductions about the individual types. Then we'll go in details. So first, I'm going to write it over here. There's the Monckeberg medial calcific arteriosclerosis. Okay. Second type, we can write it over. There is the atherosclerosis, the most important one, the most dangerous ones over here. We can write. So atherosclerosis. And the third one, we can write over here in terms of the arterial. So you can write it over arteriosclerosis. Arteriosclerosis. Okay. Now we will go first the Monckeberg medial calcific arteriosclerosis. In this case, if we just draw the blood vessels layer, if we, as we know, with the inner structures we get the tunica, intima. For example, I am showing this color. The what? Tunica intima with the endothelial cellular layers. After that, we will get the what? Smooth muscle cellular layers. You get the smooth muscles. You get the smooth muscle cellular layers. Okay. For example, let's draw one more layer over here, guys. Okay. This is the what? Smooth muscles cellular layers. Okay. And outside that, we will get the what? Tunica intima. So this smooth muscles layer we can get, and the outside we will get the tunica adventitia. So we will get the tunica adventitia. The tunica adventitia. And if we draw this over here, the same type of layers we will get also over here. Okay. Within the inner side, so we will get the tunica intima, and after that we will get the tunica media, and after that we will get the. Okay, I'm showing over here in this way. Okay. Now see, from the Monckeberg medial calcific sclerosis, that means in these cases we will get the calcified patchy depositions. Okay, we will get the patchy calcifications were within the medial layer. So we will get within the tunica media. For example, if I show over here with the red color, we can get the patchy calcifications. We will get the patchy calcifications layer were within the tunica media. So this is the patchy calcification. Okay, patchy calcifications. Now, if we see on the X-ray, we'll get the multiple, patchy calcifications. If we just do on the X-ray, we'll get multiple patchy calcified. We can write calcifications. Okay. And another thing we have to know where we can get this type of the things. Basically, this type of the thing that is in terms of we can get the benign conditions. This is in terms of the benign conditions. So it is not that much fatal if you compare with respect to the atherosclerosis. That's the most dangerous ones. Okay. So in these cases, if we just write it over here, we'll get in terms of the medial artery. What will we get in terms of medial artery? For example, we can say in terms of the upper limb arteries, we can say that your radial artery, or you can say the ulnar artery. Ulnar artery. So we will get upper medial calcified atherosclerosis. In terms of the medial side artery, we can get over here the radial artery or ulnar artery. And where we are getting the involvement, we are getting the depositions of the calcified, occlusions where within the medial layers, or we can say the tunica medial layer of the blood vessels. Okay. Now we'll go back in details about the atherosclerosis. And another important thing you can remember over here, in these cases, this thing that is palpable is the palpable. So if you just try to understand, if you just upload the axillary, yet you can just palpate these regions. Okay. For example, if I just if I just upload this axillary artery, yet you can just yet you can feel, we can just do the palpations over where in the ulnar or the radial arteries. Now we'll go back in details about the atherosclerosis. First, I'll give the very brief idea about this three, then I'll go in details about the atherosclerosis. Okay. Now, in these cases, whatever thing we'll get in terms of the atherosclerosis, see, we'll get the involvement in terms of the tunica medial layer. Sorry, tunica intima. In these cases, we'll get tunica intima. So here we'll get the depositions or the formations of the fibrofatty plaque. So in these cases, we'll get the depositions or accumulation of fibrofatty plaque where within the tunica intima. So within the tunica intima, we'll get whatever thing. If I show over here in this way, guys. Okay, let me just draw these things clearly for you. Okay. For example, is the endothelial cellular, endothelial cellular linings is the tunica intima. After that, we'll get what? We'll get the ischial muscles layer. We can say tunica media. We'll get this is the okay. We'll get the tunica media. Okay, now see, in this case we will get, okay, and let's draw the tunica adventitia also. So we'll get this the tunica, we'll get this the tunica adventitia. Now if I show over here from this is general structures, try to understand from here, guys. In this cases, if we just draw these layers, this is the internal elastic lamina that will separate the, is the internal elastic. If I show over here, this is the internal elastic lamina that will separate the what? The tunica intima and tunica media, and another layer will get over here. Okay, if I just draw in this way, this is the another layer we are getting, that is known as internal elastic lamina that will separate the tunica media and tunica adventitia. After that, we will get the tissue layers as you know normally. Okay. Now we will get the depositions of the fibrofatty plaque where within the tunica media. For examples, in these cases we will get over here. Here we get the depositions of the fibrofatty plaque. Here we get the depositions of the fibrofatty plaque in terms of the atherosclerosis. So this is the fibrofatty plaque. Fibrofatty plaque. Okay. Now, if we see this type of the development in terms of the, try to understand, if we get this type of the development in terms of the small arteries, where we will get the occlusions, where we will get the obstructions of the arteries, or we will get the narrowing of the arteries. But if we get the, this type of the thing, or this type of the case in terms of the arteries, or if we say in terms of the aorta, for example, then we will get the, ballooning, or we can say the dilations of the arteries. That means, if we get, for example, we are getting this type of the thing in the small arteries, here we will get the obstructions, and if we get why? If we get in terms of the large arteries, we will get the balloonations, we will get the ballooning of the layers. So I see whenever we are getting the deposition, this type of the thing over here, that will compress over here. As a result, we will get the dilations of the whole layers. Okay, that's why we will get the development of the balloonings. Now this type of thing we can see. Okay, where is this one? Let me erase this part, guys. So if we write it over here, then the most common place for the development of the atherosclerosis, the most common place or most common site for the development of the atherosclerosis. So you can write it over here. First, we'll get in terms of the abdominal artery. Abdominal. Okay, let's go with different. Abdominal artery. Then we'll get the development of these things in terms of coronary artery. Okay, coronary artery. Then we can get the development of these things in terms of the popliteal artery. Okay, then we can get the development of the other thing in terms of the carotid and circular villus. We can get also the development of these things in terms of the carotid artery. And last, you can remember from here the circular villus. Circular villus means what? We will get the structures, or we will get the arteries that will supply wire within the brain. Okay, this type of the thing is known as circular villus. Now, see, when we will get this type of the development in the different places, for example, if we say in terms of the coronary artery, for that regions we can get the development of the myocardial infarctions. Over here we can get the myocardial infarctions, or you can get the ischemic heart disease. We'll talk about all these things in details, okay? Don't worry. Now this is the introductions part in terms of the atherosclerosis. Now we'll go in details about the arteriosclerosis. Now one more thing about the atherosclerosis, see, when you are getting the development of the fibrofatty plaque or the deposition of fibrofatty plaque where within the tunica, intima. Sometimes we can see these things that is what. Sometimes we will see there is a chances for this thing to keep on progressing in these regions. As a result, we will see the tunica media that can be also involved. Whenever we are seeing the depositions of the fibrofatty plaque within the tunica media, tunica intima, from there this thing that can be spreaded from these regions to the tunica media. So the secondary chances for the formations of the fibrofatty plaque within the tunica media for the development of atherosclerosis. Now we'll talk about in details about the arteriosclerosis. Arteriosclerosis means, as you know, from the terms it's easy to understand what are the thing we'll get. We will get in terms of the arteriole. Arteriole means is the what? The terminal branches of the arteries. Okay, before the capillaries. Now, as far as the arteriosclerosis is concerned, we can classify the arteriosclerosis in the two types. One is known as hyaline arteriosclerosis, Another we can get over here in terms of hyperplastic arteriosclerosis. Hyperplastic arteriosclerosis. What are the problem we'll see in these cases? Let's draw the figure again and we'll talk about all these things. Now see, if we just draw again the blood vessels. So first we'll get the tunica intima. Then we'll get the smooth muscle layers, or you can tunica media. Then we'll get the tunica adventitia. Draw it properly. Okay. On the outermost layer, we'll get the tunica adventitia. And if we just draw a little bit, this whole stretches over here, guys. Now see, in these cases, we'll get the depositions of the plasma proteins within the tunica media layers. We'll get the in terms of the hyaline arteriosclerosis, we'll get the deposition of plasma protein. We'll get the depositions of, for example, if I write it over here, we'll get the deposition of plasma protein. Deposition of plasma protein. And these depositions of the plasma protein, what they will do is they will irritate the smooth muscles. From here we get the smooth muscles. smooth muscular cells, we can write it over in the better way. Whenever we get the irritations on the smooth muscular cells, as a result, they will secrete the extracellular matrix. Okay, they will secrete the extracellular matrix, and whenever we get the secretion of extracellular matrix, that will come over here, that will get deposited. As a result, we will get the development of this type of thing. Okay, the hardening arteriosclerosis is the pathophysiology, and where we can see this type of thing, we'll talk about all these things in details. Okay. Now, where we can see the hardening arteriosclerosis, we can get in terms of the senile changes. That means in the old age, we can get this type of the developments. Okay, or we can get in terms of essential hypertension. Essential hypertensions. Or another most important thing we can talk about, that thing we can get the development of, try to understand, we can get the development of the hyaline arteriosclerosis in terms of the diabetes mellitus patient. How? See, if we see over here that, especially if you talk in terms of the kidney, why we get the development of the, the arteriosclerosis in diabetes mellitus, as we know from the basic knowledge that whenever we get the more amount of the glucose levels within the circulation, so definitely this glucose that will react with the protein molecules, as we know, there's glycosylation reactions, right? So as a result, we will get these parts that will get, that will get attached along with these whole portions. Try to understand what I'm saying, guys. Whenever we are getting the glycosylation reactions, non-enzymatics, especially you have to remember non-enzymatic glycosylation reactions, especially if you talk in terms of the kidneys, where we will get the development of the arteriosclerosis in terms of the both arterioles, in terms of the efferent arterioles, in terms of also afferent arterioles. Now see, in terms of the diabetes mellitus, here if we just say in terms of the kidney, here we will get the involvement of the afferent arterioles. Along with that, we will get development of efferent arteriosclerosis. Okay. Now, if we say in terms of the essential hypertensions, in essential hypertensions, we will get the development only in afferent arteriole. You have to remember these things, the clinical aspects. What I am saying, I will repeat once again. You see, when we are talking the development of the arteriosclerosis, we can get the development of arteriosclerosis in terms of the diabetes mellitus patient. Now, in diabetes mellitus patients, if we talk about in terms of the kidney, where we will get, see, the arteriosclerosis in the afferent arterioles, in terms of also the efferent arterioles. But in terms of the essential hypertensions, where we will get the involvement only in the afferent arterioles. Okay. Okay, let's draw with a different color. I think it will be better for you. Okay. Now see, if we get, try to understand, if we get the more hyalinations, if we get the hyaline, for example, if we get the depositions of this thing, as a result, if we see the extracellular matrix, or you can say that is getting deposited more in amount, whenever the smooth muscles are getting irritated, at that time, and they will secrete the extracellular matrix. As a result, we will get the depositions of this matrix that will develop the hyalinizations. So whenever we get the hyalinizations, that will be more. So more, or you can say the severe hyalinization. As a result of thing we will get from here. Try to understand. Okay. In this case, we will get known as, write it over here, benign nephrosclerosis. What did I say? Benign nephrosclerosis. Okay. So, in terms of the arteriosclerosis, in terms of the arteriolosclerosis, if we talk in terms of the diabetes mellitus patients, where we will get the afferent arteriosclerosis, afferent arteriolosclerosis, as well as the efferent arteriolosclerosis within the kidney. And if we get the more amount of the hyalinizations over here, for the formations of the more amount of the extracellular matrix, that can lead to the benign nephrosclerosis. Now we'll talk about the hyperplastic atherosclerosis. What type of the problem we will see in terms of the hyperplastic arteriolosclerosis? In terms of the hyperplastic arteriolosclerosis, here we will get basically the hypertrophy and the hyperplasia of the Isthmus muscles layer. Okay, let's draw it over here once again. Then I think it is the tunica intima. Okay, then we will get the isthmus layers. If I draw in this dotted way, okay. For example, here we will get whatever the problem we will get. Okay. And outside layers, just consider this thing is the tunica adventitia. Now see, when you are talking in terms of the hyperplastic arteriosclerosis, we'll get in this case is the hypertrophy and hyperplasia of isthmus muscular layers. Okay, hypertrophy plus hyperplasia. We'll get the hypertrophy plus hyperplasia within the isthmus muscular layers. That means here within the isthmus muscles layer. Within the isthmus muscles layer, we'll get the hypertrophy plus hyperplasia. And where we can get this type of the thing, we'll get this type of the development in terms of the malignant hypertension. Malignant hypertension. Okay, let's repeat it once again. So we'll get the development of the hyperplastic arteriosclerosis, where we'll get the development of hypertrophy plus hyperplasia of the isthmus layers. Where we'll get this type of the thing, we'll get this type of the thing in terms of the malignant hypertensions, where the diastolic blood pressures that will be more than 120. Where we'll get the diastolic blood pressures that will be more than 120 mm of mercury. Okay, so we'll get this type of the problem over here. Now, okay, let's talk some more points about it. Along with that, whenever we're getting the malignant hypertension, so whenever we're getting the malignant hypertensions in these cases, so in these cases, sometimes we can get the formations of the necrosis in these regions. So if we just if you want to define the hyperplastic, if you want to define the hyperplastic arteriosclerosis, we can define in this way. Whenever we will get the development, the diastolic blood pressure that will be more than 120 of millimeter of mercury. Along with that, we will get the the hemorrhagic. You get the hemorrhagic lesions on retina. Hemorrhagic lesions on retina. So if we say over here, whenever we are getting the development of the hyperplastic arteriosclerosis, in these cases we will get the development of the malignant hypertension. So whenever we are getting the malignant hypertensions, in these cases we can get the development of hypertrophic, or you can say the hyperplastics over here. The development of the malignant hypertensions, we can get the hyperplastic arteriosclerosis. In these cases, we will get the diastolic blood pressure that will be 20 mm of mercury. And how can we define these things? So in these cases, we will get also the hemorrhagic lesions on the retina. Okay. Along with that, we will get the diastolic blood pressure that will be more than 120 mm mercury. Okay. So this was all about in terms of the arteriosclerosis. So we can arteriosclerosis. This is the atherosclerosis. This is the medial calcific arteriosclerosis. Okay. Now the next part we'll talk about in details. More in details about the pathogenesis, what type of the cells are involved, how in the development of the atherosclerosis, because it's the most important topic for it. Because in this, as I said the most of the cases, if we just talk about in terms of the Western country, here we'll get the 50% of the patients that die because of the development of atherosclerosis. Okay. So this is the hyperplastic hyperplastic arteriolosclerosis. When you will get the development of the malignant hypertensions. As a result, we will get the development of the hyperplastic arteriolosclerosis, or the diastolic blood pressure that will be more than 120 mm of mercury. Along with that, we will get the hemorrhagic lesions that will be found on the retina. Okay, then we can just define the hyperplastic arteriolosclerosis. So that's all about the arteriosclerosis part on. In the next part, we will talk about in details about the atherosclerosis. Thanks for watching. See you in the next video, and please do subscribe my channel.